Good evening. My name is Bridgette Baker, and I'll be your webinar producer for this evening's event. I'm pleased to introduce the National Coalition of 100 Black Women, Inc., National President, Elizabeth A. Jones.
Good evening. It is my pleasure to bring greetings on behalf of the National Directorate and members that comprise the National Coalition of 100 Black Women. NCBW is a 40-year-old advocacy organization with a network of 62 nonpartisan and nonprofit chapters across our nation that advocate on behalf of Black women and girls to promote leadership development and gender equity. Our target areas are health, education, and economic empowerment. We engage with and advocate within political, economic, and social institutions to accomplish our mission and goals. Thank you for tuning in to the NCBW COVID-19 Public Education Series webinar. This evening, we will explore unforeseen effects of COVID-19 on our children. We are grateful for the continued support of our sponsor, the Department of Health and Human Services, and our partners, the Black Coalition Against COVID, the Black Women's Agenda, Walgreens, and We Can Do This for making tonight's webinar possible. Now it is my pleasure to introduce NCBW's National Vice President of Programs, Mrs. Minnie Miller. She has served NCBW at both the local and national level for over 25 years. Ms. Miller.
Thank you, Madam National President Jones. It is my pleasure to introduce our facilitator for the National Coalition of 100 Black Women Incorporated COVID-19 Public Education Series, Dr. Reed Tuckson. Dr. Tuckson is a physician who has, among many leadership opportunities, served as the Commissioner of Public Health for Washington, D.C., and president of Charles R. Drew University of Medicine and Science, one of the 4 historically Black academic medical centers. He is also co-founder of the Black Coalition Against COVID. Immediately following CDC Director Dr. Rochelle Walensky debrief, COVID-19 vaccine for young children, published June 18th, 2022, you will hear from Dr. Reed Tuckson, our moderator.
Thank you for joining today's Director Debrief. COVID-19 vaccines are now available for children under 5. With this recent authorization from FDA and recommendation from CDC, nearly 20 million children are now able to get vaccinated against COVID-19. I know many parents with very young children have been anticipating this day. We now know, based on rigorous scientific review, that the vaccines available here in the United States can be used safely and effectively in children under 5. Vaccinating young children is a critical opportunity to protect them against hospitalization and death from COVID-19. Parents, I strongly encourage you to get your children vaccinated. If you have questions, talk to your child's provider to learn more about the benefits of this vaccine. We have taken another important step together in our fight against COVID-19 by making safe and effective vaccines available for our little ones. I hope all parents will take advantage of these life-saving vaccines and protect their children.
Well, thank you so much to Dr. Walensky for sharing those very important thoughts. And it is an extraordinary pleasure for me to serve as your facilitator for the NCBW COVID-19 Public Education Series and to bring the resources of the Black Coalition Against COVID to this partnership with the National Coalition of Black Women. The BCAC represents the combined medical professionalism and community-based experience of grassroots influencers of Washington, D.C., as well as the 4 Black medical schools, the NMA, the National Medical Association, the National Black Nurses Association, as well as the great friends that we have at the blackdoctor.org. To put our conversation in perspective, as of today, 6.5 million people have now died worldwide from this COVID pandemic, 1,048,000 in the US alone. Just last Friday, 472 people died of COVID. Thursday, 679. Friday, a week ago, 609. And on Wednesday, 1,518 deaths. These are the deaths every day, continuing. My friends, this ain't over. And unfortunately, so many of these deaths are disproportionately Black. It's important to note what's at stake. Life expectancy, we just learned just this week, in the past week, that life expectancy in the United States has now dipped to its lowest level since 1996. We've gone from 77 to 76.1 years of life expectancy in this country. This, along with a 1.8-year drop in the previous year, shows us that this is the first 2-year decline in life expectancy since 1921. For Black folks, we have dropped from 71.5 years in 2020 to 70.8 in 2021. Our life expectancy at birth in 2021 was the lowest since 1995. We've suffered, and we still are suffering. It's up to each one of us acting individually and collectively to save our lives and those of our community. The stimulus for tonight's town hall is grounded in the tragedy that while we as adults are suffering, our children are also suffering because Black families suffer. It pains me to report to you that between April 2020 and June 2021, 1 in 300 Black children lost a parent or caregiver, compared to 1 in 740 for white children. Let me say that again. Black children lost, 1 in 310 Black children lost a parent or caregiver to this pandemic, compared to 1 in 740 white children. It also pains me to report to you that there has been a concerning and disproportionate increase in the number of Black families raising children in poverty, the number of Black families suffering the effects of financial, housing, and food insecurity. All of these have incredible impacts on the well-being of our children. So I applaud NCBW for producing tonight's town hall. And with the assistance of an excellent panel of experts, we will offer you practical and understandable guidance to help you to protect your children and assist them in living a maximally healthy life, despite the continuing challenges that accompany this ongoing COVID catastrophe. Well, here's our panelists. Joining me tonight are Peter Marks. He is a physician, director of the Center for Biologics Evaluation and Research at the FDA. Simply put, Peter Marks is the man on the point who has to make the decisions ultimately and lead the process for making decisions about whether vaccines should be available and for whom across this country. He is an incredible public servant and a good friend of the Black Coalition Against COVID. Dr. Samira Brown, pediatrician, who is often sought out for her cogent health opinions and her guidance. And she is one of the leaders of the National Medical Association in the area of pediatrics. I'm pleased that my friend, Dr. Yolanda Hancock, pediatrician, noted health activist and communicator, and also a co-founder of the Black Coalition Against COVID, is joining us. And last but not least, Rena Shaw. Dr. Rena Shaw, a pharmacy doctor, who is the Group Vice President of Pharmacy of the Future and Healthcare Segment Strategy at the Walgreens Company. I'm happy that all 4 of our guests are with us. And so let's get started by making sure that we zone in on the key data. And let me start that data conversation because I want to make sure that people do not have any misconception that COVID, how much of a challenge it has been for our kids. Make sure that you understand that Black children have experienced greater rates of infections than other children in this country, although it has been difficult to assess the exact amount of increased effect because Black children are much less tested than other population groups. But we do know that around hospitalizations, that when we look at the 25 states that report race and age data for hospitalized patients, we now know that 40,000 child hospitalizations occurred in these states, accounting for about 3.2% of total hospitalizations. Let me put this in context. for all children, COVID-19 surpassed flu in annual rates of hospitalizations per 100,000. It's also important to know that there was a significant difference, and we'll get into this in just a moment, in hospitalization of children that were vaccinated and those were not. And I will tell you right off the bat that it is a very clear relationship. Unfortunately, when it comes to hospitalization, Black children were hospitalized 2.2 times more often than white children. And also, we are seeing data that is saying that 3 out of 4 children hospitalized with severe cases of COVID-19 were Black or Hispanic. And finally, to set the data stage, almost 1,400 children have lost their lives to COVID-19. Black children dying 1.7 times more often than white children, and accounting for nearly 25% of pediatric COVID-19 deaths. This is really, really, really significant. And so we have a lot to work on. Finally, I also, by the way, don't want to leave out the impact that COVID has had for our children's educational achievement, their socialization, and even their nutritional status. And so with that, Dr. Hancock, help us to understand, given how important vaccination is, what do we know about the vaccination rates? I talked about incidences of getting the disease, hospitalization rates, death rates. What do we know about vaccination?
What I would say is it's been a very slow trickle, right? The biggest bang for our buck has been when the vaccines initially rolled out. As it stands right now, in the 12 to 17-year-old age group, we now have 70% of children who have received at least a single dose in their primary series. 60% have received both. In the 5 to 11-year-old population, it has been an even slower pace. Right now, 38% of children 5 to 11 have received at least a single dose, 30% receiving both doses. And then with our babies, our 6-month to 4-year-olds, we're now at 7% of them receiving at least a single dose. And this has been since June when the vaccine rolled out. And what I will tell you, I do COVID-19 updates every Wednesday. And I report out these statistics every Wednesday. And what I will tell you, particularly for the 5 to 11 and 12 to 17-year-old age groups, the numbers have only changed by a 10th each week that I report out, if that. The 60 to 70 or the 70 to 80 range, the 30 to 38 range, it's barely budged really since the beginning of the year. And with our youngest population, from me clinically and what we look at in the data, we see that it has been a very slow uptick in terms of families taking their little ones in to get vaccinated.
And you know, what's so sad about that lack of movement is that one of the pieces of data that most Americans and even most Black people may not be aware of is that although we have suffered disparities in almost every part of healthcare, for a very, very long time, that we closed the gap in vaccination for primary series for adults. This is unprecedented. Black folks, despite having to run a race with a 100-pound anvil on our back, despite that, because of NCBW and Black churches and Black physicians and Black health professionals, we worked hard and we actually closed the gap on primary series vaccination for adults. We have got to do better for our children. My God, before we end this particular part of this conversation, Dr. Hancock, with you on this point, talk to us about routine childhood vaccinations. How are we doing just in terms of the regular vaccines that kids are supposed to get?
Absolutely. So globally, we look at the DTaP vaccine, diphtheria, tetanus, and pertussis, DTaP number 3 specifically, in terms of knowing how we're doing around the world as it relates to routine vaccinations. Here in the United States, our DTaP number 3, we have a 94% uptake. The challenge is that during the pandemic, it declined by 1%. Now, I know if you're watching, you're like, 1%? Why are you tripping? The reason is that 1% is a very big deal. I'll give you an example. So for the measles vaccine, in order to protect against an outbreak, we need to have about 95% of the pediatric population vaccinated. Right now in the United States, we're at 90.3%. That's why we saw the outbreak that we did back in 2014 at Disneyland when there was this huge measles outbreak. We've seen a lot of this happening across the country. And so even a 1 to 3% change in pediatric herd immunity will put us at risk. We just saw a case of polio in New York. I don't think we had polio here in the United States for like a decade. Now we're looking at wastewater to see the presence of polio in New York, in Boston, and other areas. And it's pretty scary given the fact that we have seen a shift in our general pediatric vaccines. And it's not just in classifying it as an anti-vax. It's not anti-vax parents that I'm talking with that are deciding either to delay or not get vaccines. These are parents with PhDs, with DRPHs, like people like me, like physicians who are really thinking through. And I'm like, there's no question, vaccines are absolutely safe and effective. But because in real time, science has happened over the past 2.5 years, because of we don't have the literacy that we need in order to understand why things change. The CDC says, don't wear a mask. Wear a basic mask, or an N95 mask, or it's a 2-part series and now a 3-part series. That's what science does. We collect data and we pivot based on the information, the evidence-based information that we have. And because a lot of families don't understand the necessary pivots in science, it makes them a little bit more distrustful of the system at large. And it requires more forums like this for us to have this conversation.
Well, speaking of the evidence for this, I'm going to be pleased to turn to Dr. Marks. And as I do, let me remind people that you can put your questions in the chat, and we will endeavor to do our very best to answer as many as we can as the show goes on. But Dr. Marks, one of the reasons why that some people are concerned about getting their children vaccinated is because they need to understand the safety and the effectiveness. By the way, congratulations on the recent announcements about new vaccines. And so why don't I start there, by the way? Why is the new announcement, let us know what the new announcements have been and why are they so important?
Yeah, no, thanks so much. First of all, thanks so much for having me tonight, and thanks for joining. The new boosters that have been authorized, they contain the same basic ingredients as the original COVID-19 mRNA vaccines, but they're modified to target the currently circulating Omicron variants, BA4 and BA5, that make up 96% of what's circulating. So they've essentially updating people's immunity for what is actually circulating right now, which we have gotten less good at fighting off. As people are aware, the vaccines right now are doing a good job still at keeping us out of the hospital or keeping us from dying from COVID-19 if we're fully vaccinated, but they're not doing such a good job anymore, at least the previous vaccines were, against preventing symptomatic COVID-19. These new boosters, by better matching what's actually circulating right now, and in fact, by matching perfectly at least half of that, the bivalent part of it. Bivalent means one component is the original vaccine, the other half of it is this BA4/5 component. That bivalent vaccine means we're matching what's circulating now in a way that hopefully will provide people with the kind of immunity that will help tamp down these infections. And so these vaccines were developed using the best science that we had. They've been brought along in looking at them. We've looked at the safety data behind all of the COVID-19 vaccines. We looked at the data for other Omicron boosters that preceded this. And so we're very comfortable with deployment of these bivalent boosters at this point, and are hoping that people will get boosted, because this way, particularly those who have never received a booster shot, which is about half of people, they will get the benefits of this vaccine in terms of preventing the serious outcomes from COVID, like hospitalization and death.
Thank you for that. That's very important. Let's zone in now, and we'll come back to this, but zone in now for just a minute on the availability of childhood vaccines. It took a while. Talk to us about why it took so long, quote unquote, long, compared to the adults and older adolescents. And what's the process that you use so that parents can feel comfortable that enough work has been done to make sure that these are not only effective, but that they're safe?
Yeah, so we don't mess around when it comes to vaccines for children. We don't mess around when it comes to vaccines for anyone, but especially when it comes to children, we need to make sure that that their safety is something that is like bedrock. Nobody can have doubts about it. So when we went to get the vaccines for children, we do what's called age de-escalation. We start with the older children, and then we work our way down to make sure that the immune response is similar, and then that the safety is there. And with age de-escalation, we were able to get eventually down to the youngest children, 6 months to 4 to 5 years of age. Now, each step of the way, we made sure that the immune response was maintained, despite the fact that in some cases we dropped the dose of vaccine because kids are naturally smaller, did not need as large doses of the mRNA vaccines. And as we made sure that the immune response was similar, we also made sure we had reasonably large sets of children vaccinated to make sure that the vaccine was safe. Roughly 3,000 children in each of the major age groups with each of the two different mRNA vaccines were studied. So we feel confident in the side effect profile that's being seen. And so we really saw no new safety concerns. We saw a good immune response. And ultimately, most recently, people may be aware that there was an announcement that at least for the Pfizer vaccine, there was reasonably good clinical effectiveness in the time of Omicron BA1. So all good news, and again, makes us feel that it's really important to get kids vaccinated, especially because a lot of kids suffered a lot from COVID. And if we can drive down the deaths and hospitalizations due to COVID, that's an important thing. I think you said it exactly right, Dr. Tuckson. There's been more problems with COVID-19 than we have in a bad flu year. And we don't consider a bad flu year to be acceptable that way. So dealing with COVID here is really important.
So let's make sure we get really clear on one thing. Since the beginning of the vaccine conversations that we've had since they were first introduced, we had all kinds of misinformation purveyors saying that the vaccine was going to make you grow a third nose and a fourth eye and who knows what kind of craziness out there. There have been, 1 billion doses worldwide now, Dr. Marks. Are we seeing any problems in those billion doses?
Yeah. So let's be perfectly straight with this. The one thing that we do see with the mRNA vaccines is, particularly in males ages roughly 16 to 30, there can be a mild inflammation of the heart that lasts for a few days in a small number of individuals. It's roughly 1 in 100,000 to perhaps 2 or 3 in 100,000, depending on the exact age range. So it's pretty uncommon and it's pretty mild. But aside from that, the adverse effects of these are generally pretty short, transient things. Yes, some people feel a little tired. Some people can have low-grade fevers, muscle aches, can kind of feel like you have the flu. But with more than 1 billion doses of these vaccines given, we have a pretty good idea of their safety profile, and they've been remarkably safe. And that's in both adults and children. So I can say that, we don't have that often an opportunity to see 1 billion doses between these two mRNA vaccines, about 500,000 billion, not used to saying that word with vaccines, 500 million doses with each of these for about 1 billion total. That's pretty remarkable. And the safety profile is pretty clean.
And real quick question, have there been Black physicians and scientists involved in the process of approving these drugs? I mean, you're in charge of it. Does the process include Black scientists?
Yeah, so indeed, we have a diverse workforce because that's something that is what we have to have in our in any place that I've worked, we have a diverse workforce. And additionally, though, our advisory committee does consist of individuals, some of whom happen to be, one of whom is president of a historically Black medical college, and others who hail from various other medical colleges. That is an important thing. It's important for us that there is a diverse workforce at FDA, and we did have a diverse workforce involved in these approvals.
And as I let you go with one last question, Dr. Marks, and that is around the question that I had asked Dr. Hancock around routine childhood vaccinations. One of the reasons that we often hear, again, are these purveyors of misinformation around routine childhood vaccines and the experience of autism. Can you please set the record straight on any relationship between routine childhood vaccinations and autism?
Yeah, so that myth has been debunked multiple times over. There just isn't an association of routine childhood vaccination and autism. And I'll tell you, we have looked for it. The National Academy of Sciences has looked for it. Other countries in this world that we work with have looked for it. We've all tried to look for it. It just isn't there. Sure. And it's really what's really important that we get our kids vaccinated, because the sad thing about this is that vaccination really is just mimicking what we normally encounter in the environment in a controlled way. So instead of getting remarkably sick with something and then being immune to it, we actually don't have to encounter that sickness. We can receive the immunization in a controlled fashion and then be protected. It is essentially like God's gift to humanity in a way. And to not take advantage of it is really a shame, because the amount of suffering that has been alleviated by vaccines in the past 100 years it's just indescribable. And so we all should be taking advantage of that.
Thank you for clarifying that. Let me turn to Dr. Shaw for a moment here. And Dr. Shaw, providing access to vaccines has been a big challenge, a challenge that the pharmacy world is now stepping up to accept. How do you see this role of the pharmacy in being able to support vaccinating our children, both for COVID and for routine childhood vaccinations?
Yeah, I absolutely love this conversation, just because I saw Dr. Marks's visible reaction of really the importance of getting vaccinated. And all of us were nodding our heads in agreement. As a pharmacist myself, I've been I've grown up with pharmacy. I'm second generation pharmacist, first generation in the country. And my family taught me early on the importance of vaccination, because what it meant in India, and really how important it was for life-saving vaccinations. When we thought of, even when I think about 10 years ago, we had H1N1 hit the country, and we were vaccinating at that time. But our pharmacists, even though they were trained to provide vaccinations, they weren't utilized in a way that really served the public in a way that really added value. And so when we came about with COVID, we started realizing there's this perfect melting pot that's occurring right now that required everyone, all hands on deck. And so what that meant was, because of the PrEP Act and the training that our pharmacists had, we were able to activate not only 25,000 pharmacists across the country at Walgreens, but then an additional 50,000 pharmacy technicians to train them to provide vaccinations. Great. And why that was so important was because, as many of you may know, 80% of the US population lives within 5 miles of a Walgreens. It's 90% within 5 miles of a pharmacy. And then you add in the fact that more than half of the Walgreens locations are in socially vulnerable areas. And so we're already in the community providing services, medication services. We're the navigation tool. When someone gets sick, we let them know, go to the doctor. When someone gets hurt, go to the ER, or actually that's okay. Why don't you use an OTC? You can pick up the phone and call one of your providers, helping to navigate. And so the fact that we've had our frontline pharmacists and pharmacy team members at the beginning of COVID helping to navigate, when vaccinations came around, we knew that we had an obligation, if anything, a responsibility to ensure that we were complementing anything that was happening across the community. And so what that ultimately ended up being is that we were able to activate now 65,000 individuals, trained professionals across the country to administer vaccinations. And these vaccinations weren't the 18 and above. This was because of the PrEP Act, we were able to train our pharmacists and our technicians to administer to patients that were 3 years of age and older. And I have
Hey, by the way, Dr. Shaw, what is the PrEP Act, by the way?
Oh, I'm sorry. I talk like everyone understands my pharmacy nerd language. So the PrEP Act is actually what it is. It's legislation that was approved by the administration that removed the state-by-state barriers that would be in place in order for our pharmacists to administer a vaccine. So for example, in Illinois, pharmacists were able to administer it for 3 and up because that's what we were trained for. But in other states, it was 18 and above. And when the pandemic hit, the administration, the various agencies, maybe CDC and FDA and the administration were able to break down those barriers because we knew that it was all hands on deck. And what that allowed us to do is across the country, no matter where you were, our pharmacists were able to provide vaccinations and testing services for 3 and up. And so
now, this is really, really glad to have that in place. One last quick question for you before I move on to some of the other panelists, and that is the women who are listening. It's not only women listening tonight, but let's be honest, women make 70% of all the health decisions for the family. They need to hear from you how, if you go to a pharmacy to get your immunization, how important is it to connect that experience with your regular medical home, with your regular doctor?
You know, and the great thing is we do that for you. You go to any pharmacy, you let us know who your physician is. And that is something that's on the form, that where did you go ahead and get your vaccination? Who is your primary care physician? We communicate that, but that's not the only thing we do. Regardless on if you remember who your primary care physician is, or if you only see an OBGYN, or if you forget your pediatrician's information, we do submit every vaccination to the state registry, as well as to the registry that's at CDC. And so it allows every pediatrician, every provider that's out there to go ahead and pull the most recent updated records so that they have the complete medical home. So at the end of the day, the patient, the mom, the child, you don't have to worry about that. We will handle it for you because we know how important it is to connect the child's information as well as the parent's information back to the medical home.
Thank you so much. Dr. Brown, on that point, let me make sure that sometimes the records are more or less, the electronic systems work and registries work, and sometimes they don't. Dr. Brown, how important is it from you and your clinical practice that all these things be coordinated and that parents keep their own records of their medical care for their child?
You know, we definitely take that onus as pediatricians to make sure that we, update those immunization records almost every single time your child comes to the office. They are going to have their immunization record looked at, right? And one of the things we're now asking, have you gotten your COVID vaccine if you're 6 months and up? And it is very easy for us to, in most systems, it's a click of a button to pull that from the outside pharmacies because we're already linked in with our state system. So you definitely don't have to worry if you get it at a pharmacy or outside of your pediatrician's office that we won't be able to record it. And if for some reason it didn't upload into the state system, we can do that for you.
Outstanding. Dr. Hancock, let me come back towards a pure COVID lens for a moment. And I mentioned earlier about the number of Black children who have lost a caregiver because of the pandemic. Help us to, as a pediatrician that's seeing patients all day, every day, how important is it to look at the Black children's health through the lens of the total family's health?
It's critically important in order for us to truly appreciate how disproportionately impacted Black children were. We have to do that. We know that Black and Brown parents were the workforce during the pandemic. 75% of people of color did not have the option of teleworking. They were what kept this country running. Children's National did a study back in 2020 showing that the leading risk factor for children in terms of COVID-19 infection was what their parents, what their mommies and daddies did for a living. And to your point earlier, we know that people of color struggle to have access to testing. They were at higher risk for exposure. And when you think about sort of the constructs that were in place even prior to COVID, it's people of color who are working in places without family leave, without paid sick leave, and being compelled to show up for work even in the face of being sick. You're talking about multi-generational households where the person who's going to work may then expose a grandparent, an aunt, and uncle, which then facilitates them being at higher risk for hospitalization and death. And again, linking back to your point about losing caregivers and parents, 65% of children who lost a caregiver or a parent were Black or brown. So we also have to talk, and I know we'll talk a little bit more about it in terms of the mental health impact. We have to look at all of what we classify in public health as the social determinants that impact children during this pandemic. So the financial implications. We know that the majority of children living in poverty, experiencing food insecurity, housing insecurity, financial insecurity, were all Black and brown children. And it isn't that their parents weren't out working hard, it was that systemic racism facilitated these disparities. And we saw that recognized even as early as April of 2020, when we saw the shift in the numbers as it related to who was getting sick with COVID, who was being hospitalized due to COVID, and who was dying from COVID. It was people who looked like you and me, Dr. Tuckson. And so when you think about all of that happening simultaneously with police brutality, right? Our children watched George Floyd murdered. Our children watched Ahmaud Arbery murdered. Our children experienced all of these things. And then to top it off, they then had to witness children being massacred because our country lacks gun laws to protect them. So we're talking about all of these things happening simultaneously while dealing with healthcare provider shortages, mental health care provider shortages, even with the government providing additional child tax credits and SNAP benefits. It still didn't provide sufficient resources for our children to be able to be covered and protected. And then they didn't have their safety nets. They were out of school. And so abuse increased. The CDC did a study back in 2021 looking at over 7,000 teenagers, and 1 in 10 of them reported physical abuse or emotional abuse during the period of the pandemic. 1 in 10, and this is just 7,000 adolescents. The majority of those questioned were Black or brown. And so when you think about just that snapshot of children and what they've experienced, how does that impact them from a physical, mental, and relational health standpoint?
Well, I'm going to turn that to Dr. Brown, but let me just say, Dr. Marks, if you can hold on, I'm glad you're here because there's a couple of questions we want to ask you really fast in just a moment. But Dr. Brown, with all that we just heard from Dr. Hancock, when you're talking to the family about trying to get our kids vaccinated against COVID, and they have all that backdrop, what's that conversation like? What are the challenges that you are facing in overcoming whatever resistance you may be seeing when you're in the exam room with parent and child?
You know, I think that we as pediatricians take that relationship that we have with families. You know, we don't, want to make sure that we don't pressure families, that we understand that they need to trust our information and that it may be subsequent conversations that we have. And so we want parents to know that they can come in and they can ask their questions, that they'll have plenty of time, that they can ask any question, right? There's no silly question or stupid question to ask, right? And we understand that not everybody is ready to get vaccinated on day one, and that's okay. That's what we're here for, to give you that information and to let them know that it's safe, that it's effective, and to prevent the other complications that you can have, not only of acute COVID, but also of the other complications that children can have, also disproportionately amongst Black and brown children. So we definitely find that when we have a good, trusting relationship with our families, that we are able to convince them to get vaccinated by giving them good, sound evidence that we know about.
And Dr. Shaw, let me just ask you as well, are you hearing any anecdotes from the field or from all of these different pharmacists working in local community pharmacies? And I was very glad you mentioned how many of them are in Black and social disadvantaged communities. Are you hearing that they're having a hard time convincing parents to get their children vaccinated against COVID?
Yeah, there's been hesitancy from the beginning. just with vaccines in general, due to the history of how vaccinations and healthcare had really supported communities of color. And so there was a lot of education that had started off, but it wasn't us alone. So our pharmacists are the most trusted profession in community-based care, which is why we're able to go ahead and help navigate. But it was in partnership with faith-based organizations, in partnership with like organizations like NCBW, where we were able to leverage that expertise, but then also partner it with an organization that did have that trust. Good. Coupled with that piece. So we have seen quite a bit of success by repeated information and conversation, as well as the fact that our Walgreens tend to be reflective of the communities that we're serving. 45% of our employees our team members are of diverse backgrounds, serve the communities that they really live in. And so there is a sense of security when you know that it is someone that lives around the corner or that lives and is invested in the community that is telling you the same thing that they would do for their child. And so that's been a huge benefit, but it did take time. And
let me one sentence answer here. How much does it cost if I took my child into Walgreens to get them vaccinated against COVID today?
$0.
I'm sorry, what was that?
It was $0. It was free. It's free for a COVID vaccine. So
Thank you very much.
Please get vaccinated.
Dr. Marks, our audience wants to know, is it necessary for children to get booster shots? Why or why not?
So there are going to be appropriate times for kids to get booster shots, and we will be making that known. Right now, adolescents should be getting booster shots, 5 to 11-year-olds. The youngest children don't need booster shots just yet. We'll be coming along with recommendations for them as we get the information about when they need it, because remember, they've only been vaccinated with their primary series more recently. But just like adults are going to need kind of a freshening up of the immune system, younger children will also likely need that as well.
So let me make sure, Peter, that I've got it. If I have a teenager that was in the first round of vaccine eligibility, should they be thinking about getting a booster?
They should be, indeed. They should be, indeed. And these boosters that were just authorized, the Pfizer booster is authorized down to age 12, so that they can get a bivalent booster and get the advantage of having that protection. And I suspect that within the next several weeks, you will see additional authorizations coming to a pharmacy near you for boosters for other vaccines, so that they'll be the same for Moderna, and then eventually we'll work down to the younger children.
All right. So, and by the way, for the adults and for the adolescents, the older children for whom they are eligible now for the booster, how long do they wait to get their booster after their primary series? I mean, what's the time lag? How close can these happen together?
So at least 2 months. At least 2 months is what we're saying. And frankly, for most people, it's been a lot more than 2 months. But at least 2 months. And the only caveat to that some people, I would be remiss for not saying, is if somebody's had COVID-19 in between when they got their primary series, they should be completely recovered from COVID-19. And then it's really their choice. They can go ahead and get their booster, or CDC says they can wait up to 3 months before getting the booster. And it's really a matter of something to discuss with your doctor and a matter of personal preference.
Thank you for that. And let me be very clear with the audience that if you want to know more about what Peter is saying with this guidance, he's been very clear about it, but things are going to change in the coming weeks with more information. Use the CDC website. It is so clear cut as to what to do and when to do it. And I will continue to say to everyone in the audience, the CDC website is terrific. It knows what it's saying. The guidance is medically sound, and that's really where you need to go. Let me turn to you, Dr. Hancock, for a minute. I'll come back, Peter. There's another question we'll get to in a moment. But Dr. Hancock, you, one of the most important things that parents have to make a decision about in terms of vaccinating their kid against COVID is going back to school and for play dates. And I'm going to ask you the same question, Dr. Brown. Now, Yolanda Hancock, I see that you have an unusual backdrop to your set today. And I think it has something to do with going back to school. So can you answer the question and also explain your backdrop?
Absolutely. So my first and most important job is that of mommy. I am proud to have a 9-year-old fifth grader in my house. Every year we put up the same banner since preschool that sets the tone for her school year. So it says Mara's first day of school, and surrounding it are positive affirmations to kick off her year right. One of the ways in which we kicked her year off right was making sure she got her COVID-19 vaccines and that she had her mask, KN95 or N95 mask, a set of 3 to protect her. We knew going into the school year that with the BA.5 variant, this is our most infectious yet. Some people would say it's a milder, gentler version of COVID. I'm like, I don't want any of it. And so knowing that, we talked through how to navigate going back to school. Her school actually is going to be offering still, even though the CDC has moved away from it, they're going to be offering weekly COVID-19 testing screening for families who want it. So I was like, yes, we're going to sign up for that too. So you're going to get your vaccine, you're going to wear your mask, and you're going to get tested so as not to bring cooties home to your entrepreneur mommy who has her own practice so that she can still see patients. And I think it's really important for parents to understand where we are in the pandemic in terms of bringing their kids back into school safely. We know that most of the mitigation strategies that have been in place from 2020 all the way through until the school year 2022, they are no longer necessarily in place. We don't have standard screening of all students. We no longer have mask mandates. We no longer have contact tracing, all of the things that we originally had to sort of manage the pandemic. So it's more of a shift of personal responsibility. I have my own personal feelings about it, but I will focus on what you asked me. It's what are you doing as a parent or guardian to protect your child, yourself, and your community. And part of that protection is strongly considering getting vaccinated, even though your Uncle Ray Ray says this batch of COVID is no different than catching a cold. I had COVID at the end of June because there were no mitigation strategies at my daughter's former school. She got it. 3 of her classmates got it. I'm still waiting for the notification that at least 20% of the class had COVID. And because she had it, and I'm her mother, I ended up getting it. And then her father, everybody got COVID, right? I don't ever want that again. It was worse than any cold I've ever had. And the last time I had flu was when I was 18, because every year I get my flu shot. So you have to really think through what is the risk. And to Dr. Mark's point about myocarditis, the inflammation of the heart muscle, what's important to note is that the risk of myocarditis is higher with COVID-19 than it is with getting the vaccine. And specifically, the highest risk population in that teen group are white male patients. And so when particularly families of color are thinking about getting their children vaccinated, and they're like, I don't really see a big risk, it's not just this gentler, milder version of COVID, it's the complications that result from it. I'm sure you're going to ask about long COVID in a little bit, but we know that from looking at race-based data, a good portion of children who are dealing with long COVID, and the majority of children who came down with multi-system inflammatory syndrome, were Black or brown children. And I'm dealing with patients now who are dealing with concentration issues, decreased lung capacity, increased blood pressure, and they've never had high blood pressure before. And I'm not talking about their 70-year-old grandparents. I'm talking about my pediatric patients. And so it's thinking through all of those things.
So let me do this. That's perfect. And what we're going to do is I want to just really lock in on what you're sort of getting at. And that is, understand, audience, that there are 2 sequelae that are associated with getting COVID, and that's long COVID and something called multiple inflammatory syndrome. Both of these are scary concerns that can affect a child for the duration of their life, and certainly in the short run. And so when someone says to you, Uncle Ray Ray, that this ain't a big deal, first of all, Uncle Ray Ray didn't go to med school, don't know what he's talking about. And that we have to be very concerned. Well, we're going to go really fast through a lightning round of questions. And so we're going to ask our guests to be really, really succinct so we can get them all. And first, let me go to you, Dr. Brown, and ask, why is it if children don't frequently experience severe illness, why do they need a COVID vaccine? And I think maybe we have got some of that, but what would you say?
No, absolutely. I think, you guys have definitely heard this through the panel. They can have very severe, both acute illness, even though that's more rare. They can definitely be hospitalized. And when they're hospitalized, some of them even need intensive care unit, care. And then post-acute infection, you can also have both the long COVID that are symptoms that can last definitely over 4 weeks, but it can happen endlessly because we're still studying it. And we don't have great treatments for it because we're still learning about this. We don't know how long this is going to impact, children. So to have, a 5-year-old who has, inattention and brain fog or is not reading at the same, not processing the same, that is a major effect of post-COVID, potentially. And also certainly you have a very rare but very serious complication called MIS that also too is disproportionately seen in Black and brown children. And these are children who have fever for more than 24 hours and they get inflamed organs in their body, their heart, their brain, their skin, their intestines, and they have to be filed in, specialty care clinics. And usually most of them are going to be in the ICU getting treatment. So certainly if your children has any of these symptoms right away, you need to see your pediatrician.
And don't play Russian roulette with this disease. Dr. Marks, are there any children who should not get a COVID-19 vaccine?
The only reason really not to get a COVID-19 vaccine would be because a child has an allergy to the constituents of the vaccine. But even children who are immunocompromised will ultimately benefit from the vaccine. And there are special protocols to give them an extra dose of the vaccine. And I'm just going to say one thing that I got to offer up here, which is that this kind of minimization of, there aren't that many kids who die from COVID-19. If anyone, and I have close relation who lost a child, any child that's lost to an infectious disease needlessly, that's a catastrophe. It's horrible for the loss of the child, but it destroys a family as well.
Wow. And again, as I cited that data at the top of the show, which really hurt my heart to have to say, Black children are well over the disproportionately affected in death. If you can't say you love that Black Lives Matter and play Russian roulette with Black children, it just doesn't make sense. Peter, one other quick question, and that is, why is it not recommended for children under 4 to receive boosters?
And that's simply because we just don't. My guess is in the next couple months, you'll hear about that. But right now, it's just we haven't had enough time passed. And for kids, we told you we have to be careful. We need to make sure that giving those extra doses, it's safe to do so and that it brings benefit in a manner that outweighs any risk. And that's all we're waiting to do, is to get the data to say that that's okay.
Dr. Hancock, if my child contracts COVID while vaccinated, can I still send them to school with a mask? What is recommended?
That's an excellent question. My little one could have gone back to school with COVID within the time period that the CDC recommended. She had been afebrile after 5 days. In good conscience, I just could not send her back to school. She was still testing positive, and although the CDC does not require a test out, mommy did, because I could not, in clear conscience, send her back to school. And so I would say, from a public health standpoint, from just a good karma standpoint, keep your little one at home. I know the challenge for a lot of parents is that they don't have paid sick leave and paid family leave, and it becomes challenging economically. But I would say do what's right for the collective and keep them at home until they're no longer contagious.
Dr. Brown, apparently someone in the audience has a child with tinnitus, a ringing in the ear for the lay audience. Any idea how to answer a question? How long does it last after COVID?
So that can vary, right? A lot of kids can have these kind of symptoms that will progressively, kind of get better over the course of a few weeks, like most, post-viral symptoms. But certainly if it goes beyond 4 weeks, you definitely want to come in and be seen. And just if you haven't seen your pediatrician for it, just initially, that you definitely need to check off your list as well to make sure that it is coming from COVID, not from something else.
And now the last thing, we only have a minute or so left, but I want each of you to at least have 10 seconds of all of the things that you have said or not said, just right to the point, that you want this wonderful audience to hear on this topic. Dr. Marks, what is the one thing that you want to leave with this audience?
I just want people to get yourself vaccinated, bring the kids along, get them vaccinated.
Dr. Hancock.
Anxiety and depression in children has increased by 26% as a result of this pandemic. Black children are nearly twice as likely to attempt suicide. If we don't control this pandemic by getting vaccinated, not only will their physical health further be impacted, their mental health will be as well.
Rena Shaw.
I'm going to build on that. Save your children's and your life and the ones that you love the most by getting vaccinated. And you can do that at a local Walgreens pharmacy near you.
Dr. Brown.
The vaccine is safe, it's effective. And if you got your first series, make sure that you are boosted and make sure that your children are. If you have questions, ask your pediatrician. And when in a crisis, certainly mental health, we've seen that. Please call 988. There is a new national hotline number that is 988 that you can call in the midst of any crisis.
Well, thank you to this wonderful panel. And as I turn it back over to First Vice President Miller, let me say that to you, Vice President Miller, that NCBW, its advocacy work around the social determinants of health and other elements that have come out tonight really need to be applauded by the entire Black community. NCBW is fulfilling an incredible role, not just by hosting these town halls, but also by what it's doing behind the scenes to create a favorable and healthy environment for Black families and Black children. So as a member of our community, I just want to say to you all, thank you for everything you're doing, and take it over, Vice President Miller.
Thank you, Dr. Tuckson, for serving as our moderator, and a special thanks to our panelists, Dr. Marks, Dr. Brown, Dr. Hancock, and Dr. Shaw, for providing that much needed information on the unforeseen effects of COVID-19 on our children, why vaccinations are important. We would also like to thank our sponsors, the United States Department of Health and Human Services, the Black Coalition Against COVID, Walgreens, and the Black Women's Agenda Incorporated. A special thanks to our National President, Elizabeth A. Jones, the National Directorate, staff, National Health Committee, and our producer, Bridget Baker. We want to hear from you. Please take a few moments to complete a quick survey about tonight's webinar. You can either scan the QR code on the screen or use the link that we've dropped in the chat. Your feedback helps us to continue bringing programming like this one to the community. We appreciate each of you participating this evening, and we believe that you are better informed on the information on the unforeseen effects of COVID-19 on our children and why vaccinations are so important. We invite you to register and participate in our additional webinars. We have 2 more, and we're looking forward for your participation. Enjoy your evening.